Hello, my name is Julie Emerson. This presentation is called Database Design for Heart Failure Hospital Readmissions. We will be covering the following items. We're going to introduce a scenario, talk about the database system, the features, security considerations, the use case. We will review the main objectives and data model, discuss the database report, the logistics, security features of the report, and conclude. In this presentation, we will demonstrate the use of a database proposal through a fictional scenario at a fictional hospital. My city hospital faces a complex problem that its administrators and clinical leaders are not quite sure how to solve. My city hospital has a population of patients who are frequently readmitted within 30 days. The medical and nursing staff are frustrated with this population because they feel they are fixing the patient's issues in the hospital only to see them return again and again with the same problems. The case management staff continues to offer supportive services during each hospitalization, but those services don't seem to be helping. Often, these patients return before their post-discharge follow-up appointments and have not even seen their community specialists. The risk director has been tasked with finding a solution to this issue because not only are these patients not improving, but they are also costing the hospital a lot of money since the Centers for Medicare and Medicaid Services implemented the Hospital Readmissions Reduction Program. There needs to be a way to find out why these patients keep returning so often. One of the more critical considerations for any healthcare database is protecting patient privacy and keeping personal, financial, and healthcare-related information secure. However, keeping electronic patient-protected information secure and maintaining cybersecurity in healthcare are daunting tasks. According to the Breach Portal website of the U.S. Department of Health and Human Services Office for Civil Rights, it appears that almost every breach incident is a hacking or IT event involving network servers or unauthorized access or disclosure via email. Security measures for healthcare databases require a multi-layered approach, including firewalls, real-time analysis of database activity, and user education on email-based cyber attacks, according to Pullen in 2018 and Tamor in 2021. The three most important security features for the database project are protecting patients' privacy and protected health information by, number one, controlling who has access to the data. Number two, safeguarding the database's integrity against data loss or tampering. And number three, implementing an encryption system. According to Wasim et al. In 2025, controlling database access is essential to healthcare cybersecurity. Additional concerns are privacy breaches and data integrity issues. Wasim et al. 2025. While technology has inherent limitations, the strongest and weakest parts of any security system are the human element. The Great Wall of China was breached by only one man, Genghis Khan. All other invaders relied on internal compromise, according to Lee in 2025. The best security devices can be put in place, but without vigilant people keeping watch, no real security exists. This axiom holds for all types of security, whether physical or in cyberspace. In the end, human beings are where the buck always stops. It is the human being who creates the security system and the human being who monitors it. The focus of security for this database will be the human element. The Great Wall was infiltrated more often through deception and bribery than through outright damage to the structure, according to Lee in 2025. Basic Sun Tzu principles involve overcoming the enemy without fighting, the use of deception, and using surprise where the enemy is weakest, according to Cantrell in 2003. Rest assured, these are the tactics cybercriminals use when attempting to hack, phish, or inject ransomware into a healthcare database. While Sun Tzu's warfare tactics are ancient, human nature has not changed, and preparing for such cybersecurity attacks is key. According to Malwell and Sambasivam in 2023, electronic medical records and electronic protected health information accessed via cloud and/or networks seem to invite hacking and IT incidents due to weaknesses in cybersecurity protocols and technology. Furthermore, the author suggests that the human element related to this issue is a lack of expertise in creating, implementing, or managing an effective digital defense strategy. Malwell and Sambavasim in 2023. To address these concerns, the following security measures will be implemented. First, the database employs a simple design that collects key information without requiring knowledge of patient names, contact information, or financial or health insurance specifics. Furthermore, the database will be accessed only by one department outside of the IT department, comprised of 2 staff members, the heart failure coordinators. Lastly, the database will employ two-factor authentication, which can effectively thwart up to 90% of credential stuffing data breaches, according to Friedman in 2024. By using these security features, the healthcare database for the My City Hospital Heart Failure Readmissions Task Force will remain secure and free from electronic patient-protected health information breaches. This is the use case of the current workflow. As you can see, the My City Heart Failure Readmission Task Force is trying to resolve how to prevent heart failure patients from readmitting to the hospital, and they are facing challenging issues. It's a puzzle. They don't understand how to solve it, and they're not really sure what exactly to do. This slide depicts use case number 2 after incorporating the database. Here, the My City Hospital Readmissions Task Force has a clearer picture because of the use of the database of what to do, and they're able to come up with some innovative ideas that shed light on how to solve the problems that the heart failure patients are experiencing to prevent further readmissions. The My City Hospital Heart Failure Readmission Task Force has been working on a database to help the team identify factors that cause 30-day hospital readmissions. The team has narrowed down the data points that they believe will shed some light on why heart failure patients return to the hospital so frequently. The team has asked the database designers to gather pertinent data from heart failure patients who have returned to the hospital and been readmitted within 30 days. The data points the team would like to focus on are heart failure stage and class, length of stay of the initial hospitalization and the subsequent readmission, and the number of days between hospitalizations. The team will review whether components of the American Heart Association's target heart failure discharge checklist were modified during the initial hospitalization, and the team will examine whether the readmitted patients also had a significant social determinants of health. To verify that the team agrees with the data points to be included in the database designers have compiled a final table list for the team to review, shown in the slide. After consensus is reached on the data points, the designers present the team with a data model diagram to help them better visualize the database. A data model is a diagram that shows how data and workflow are connected in a database, according to Corbo in 2023, Sharma et al. In 2021. The database designers presented the data model to the team to provide a basic understanding of how the database would be configured and to enhance communication as the project moves forward. The data model design is represented in this slide. The My City Hospital Heart Failure Readmissions Task Force now has a better understanding of how the database will work and what information it will provide. Some team members had never understood how the data points were connected until those relationships were mapped in the data model design. The data model design clearly depicts the roles and contributions of each entity, defining relationships that were previously unclear. The My City Hospital Chief Financial Officer is seeking ways to save money for the hospital. She is aware that the Centers for Medicare and Medicaid Services, CMS, penalizes hospitals that the agency deems to have excessive readmissions. She is also aware that the heart failure patient population is known to have some of the highest hospital readmission rates, according to the Centers for Medicare and Medicaid Services in 2025 and Kosiol et al. In 2012, and to generate enormous healthcare costs, Lesson 2024, Madanat et al. In 2021. The My City Hospital Quality and Risk Director has created a heart failure readmission task force to address trends associated with heart failure readmissions. The task force meets biweekly to discuss heart failure case studies and review trends in this patient population. To help determine why heart failure patients are readmitted to My City Hospital, the Quality and Risk Director has instructed the Heart Failure Coordinator to maintain a heart failure readmission database to track specific information. The Heart Failure Coordinator is preparing for the next task force meeting and needs to generate a report from the database to share information with the team. She knows that to be effective in sharing information with the team, she needs to create a report that presents the database information in an easy-to-understand format, according to Kruzik et al. In 2025, Pamaskin and Filippov in 2022, and Sharma et al. In 2021. Enabling the team to determine the next steps to prevent heart failure readmissions, Habi et al. In 2023. The Heart Failure Coordinator has decided that when she presents her data at the next My City Hospital Heart Failure Task Force meeting, the following questions should be answered. How many heart failure readmissions are there? What are the main reasons heart failure patients are returning to the hospital? Are there any mitigating factors related to heart failure patients getting sicker? The Heart Failure Coordinator wants to create a report that addresses her key questions and makes it easy for the multidisciplinary task force to understand the issues involved. The My City Heart Failure Task Force has identified several data elements that would be helpful for better understanding the heart failure readmission population. These elements will be the columns of the database table. While the Heart Failure Coordinator may not want to use all the data elements in every report, she wants the option to retrieve them when needed. As the Heart Failure Coordinator makes her list of data elements, she knows that not all the elements will be captured in the database because patients are not receiving all of the interventions represented by the data elements. However, she also knows that if the data elements are missing, the team will not be able to tell whether interventions have been implemented. The Heart Failure Coordinator decided to include the following data elements. The number of days. This refers to the number of days between hospitalizations and is represented by a numeric value between 0 and 30. The length of stay. Separated to identify both the initial hospitalization length of stay and the subsequent 30-day hospital readmission length of stay. Heart failure stage and class, identified as stages A, B, C with classes 1 through 4, and D with classes 1 through 4. Social determinants of health includes yes and no responses to whether the patient has health insurance, stable housing, transportation, can afford medication, can afford food, can pay utilities, and has a caregiver. Heart failure discharge checklist includes yes and no responses to interventions performed during initial hospitalization, including ACE, ARB, and ARNI for left ventricle ejection fraction of less than or equal 40%, or documented contraindication, evidence-based beta blocker for left ventricle ejection fraction of less than or equal to 40%, or documented contraindication, carvedilol, metoprolol succinate, bisoprolol, heart failure counseling or education, nutrition consult, home health care if indicated, cardiac rehab if indicated, cardiology follow-up appointment within 7 days of initial hospital discharge, follow-up phone call with nurse navigator. The heart failure coordinator has requested that some filters be included to manipulate the data and address different areas of focus. Filters help provide more detail about different subgroups of data. Filters also exclude data that does not meet the filter criteria. Two of the filters the heart failure coordinator is sure she would like to be able to use are filter by date range, filter by disease severity, removing all patients who are determined to be at end-stage disease. The heart failure coordinator would like to share this report via PowerPoint, email, and as a portable document format, PDF, file for printing. Reporting frequency will be biweekly to coincide with task force meetings, with the ability to run reports at any time to capture the time frame needed for presentation. The report will be run from the database server. The report should be straightforward, easy to read, and understandable. It should be in a format that is easily shared across different electronic media. The report should have the most up-to-date information. The data included in the report should be accurate and reliable. The data presented in the report should be relevant. The information included in the database and database reports should be secure. Security is an important aspect of database design. The My City Hospital Heart Failure Task Force database has several security features. One of the built-in security measures is the omission of patient names, contact information, financial information, and health insurance specifics. Another security feature of the database is limited access. Only 2 departments will have access to the database: the Information Technology Department and the Heart Failure Coordinators. Finally, two-factor authentication will be required, preventing up to 90% of potential data breaches. Kamba et Dauda, 2025. The My City Hospital Heart Failure Task Force meets bi-weekly to discuss ways to prevent future heart failure readmissions. The multidisciplinary team has learned that the creation of a database to track heart failure readmissions and associated factors can help them look at this issue in new ways. One of the ways the team will be able to share information is through database reporting. Easy-to-read reports with timely information in a PDF format will allow the team to share data for reports to hospital administration, community leaders, and regulatory agencies. Database security is built into the database, as patient name and contacts, financial, and health insurance specifics are not included in the data elements. Additionally, limited staff access with two-factor authentication will help prevent database breaches. This concludes the presentation. Thank you for watching.